Health Secretary, has vowed to scrap more than 1 million what he describes as pointless NHS hospital appointments. This is a way of cutting waiting lists. The Health Secretary said that waste of time hospital checkups should be scrapped, and that would free up consultants to carry out more operations. Officials say that around half of these routine checkups could be phased out by making greater use of smartwatches and wearable tech to monitor patients' blood pressure levels remotely. Let's talk about this with Dr. Tony Oates, retired consultant paediatrician and co-chair of Keep Our NHS Public. Dr. O'Sullivan, thank you very much for joining me on the programme. What does he mean by pointless appointments? I mean, if you say to people who are waiting for an appointment or are sitting in a waiting room, literally waiting for an imminent appointment, and you say, is your appointment pointless? Presumably they don't think so, or they wouldn't bother showing up to it, would they?
Good afternoon. It's a use of language that is not very helpful, is it? I think what he's trying to say is that you could use outpatient appointment consultations more efficiently. And that kind of assertion isn't new, really. On a personal level, just after lockdown, I had my own experience of a cancer operation, which was successful. But after the operation, I didn't see a single person in person for the rest of the treatment.
Yeah.
I was lucky. I had no problems. I had no communication barriers of my own. I can hear well, I can see well, I'm mobile, I can use IT, and the telephone consultations were very satisfactory and all went well. Yeah. But that is very much not the case for a very large number of people. So those appointments can be a time where somebody's really looking forward to ask questions that they're worried about, and to make sure that they are understood by the hospital team or the GP indeed.
Isn't this though a relatively kind of simple miscalculation, because surgeons, those are the people who perform operations, and Wes Streeting has said he wants, the number of operations to go up by freeing surgeons from these pointless appointments so that they are free to operate. But actually, surgeons don't attend patients at pointless appointments. Surgeons either see the patient before the operation so they can work out what is the surgery required here, what is the operation I'm going to do, this is what it's going to entail, this is how long you've got to take off work, this is the kind of position you're going to have to sleep in bed for the next 6 months or whatever it is. And then they see them after the operation to check that the operation has gone well. I mean, neither of those things are pointless, are they? And you wouldn't imagine absolving surgeons from any contact at all with the people they're about to operate on or have operated on in order that they can operate on more people that they never see either before or after the operation. They wouldn't like that very much, and neither would the patients, would they?
The danger is that you put the onus of the assessment and decision-making on the patient, and you introduce potential risks of safety and well-being. In my own case, it was a very well-resourced London teaching hospital, and the follow-up done remotely was by very, very good specialist nurses. Now, if Wes Streeting is planning to roll out what is already good practice in many, many hospitals, rolling that out around the country, and if staff feel they're supported to extend that kind of practice safely, then I'm sure lots of the NHS will welcome potentially better care and effective communications. But there are many caveats there. And one of the things that I really worry about is that Wes Streeting and Rachel Reeves have made a decision that the NHS can be transformed without significant funding to transform. The budget in the end of October was really emergency budget to keep the NHS from collapsing into debt. It didn't really provide anything for transformation, and I think the reliance on really good care, for example, the jargon of transferring care from the hospital into the community, that is not necessarily a cheap option. You need really well-trained staff who have the clinical skill, confidence to go into people's homes or to go into care homes on their own usually and make assessments and treatment decisions that then can be backed up by a team at the base in the health centre or in the hospital. So you actually need significant investment, and at the moment that is not there. So I worry on a number of fronts, and one of the biggest worries I have is that the over-reliance on apps and gadgets potentially raises the issue of health inequalities, because those people who are at most at risk, they've got communication and language problems themselves, hearing or vision problems, they don't have access to IT or gadget or how to use gadgets. They may have levels of learning disability, or they may just have no money and they're living in poverty, homeless accommodation, etc. All of those issues are very real barriers to the offer of personal choice and using app-based communication with the health service. So I think my conclusion is that the government's plans may be going in the right direction, but they cannot be replacing significant investment for the NHS to make it a safe and excellent service again as it was in 2010.
Okay, let me just read you this. Mr. Streeting, this is the Health Secretary, of course, said the NHS is scheduling over 1 million pointless appointments every year, adding that this sort of waste and inefficiency is why patients are waiting up to 18 months for treatment today. I regularly, says Wes Streeting, hear of patients having to take time out of their day and time off work to attend a follow-up appointment they've been automatically allocated, which simply isn't necessary. I want to give them the power to be treated on their terms and end this wasteful practice. Is that something that you recognise?
I think he's taking anecdotes and extending it to accuse the whole of the NHS.
Yes, quite.
Of being wasteful and you know, the jargon phrases the NHS is set in aspic from 1948, and it's just not true. But you need investment. You need a very well-resourced admin team. You need people who have the right IT backup system that talks to themselves and other services, then you can safely do away with appointments. If you have the alternative, which is a telephone consultation, or you've selectively chosen the patients that you know can safely advocate for themselves. And it is not a replacement for a public service that has the responsibility to put the patient first, including the most vulnerable patients, and offer them face-to-face appointments if that is appropriate. I can quite easily see that some appointments aren't needed, but hospitals up and down the country, including my own experience, have reduced that where they've been able to do that already. What they need is a well-resourced, well-staffed, well-equipped health service with the right IT backup, and gadgets are very good if they are well supported by a team that knows how to use them and patients that know how to use them. Gadgets for blood pressure monitoring and diabetes monitoring, these aren't new inventions. The reason they are not widespread is that the funding hasn't been there.